CareLodge was founded in 1981. A group of local professionals with St. Paul's Episcopal Church got together, and there were a lot of calls coming in, crisis calls coming in on the mental health crisis line. And it was decided that Meridian needed a domestic violence shelter. So CareLodge was started in 1981 with a $5,000 donation from St. Paul's Episcopal Church and with the local Mental Health Association. We have continued to provide services to victims of domestic violence. Our sole focus is victims of domestic violence. Even though we have grown our programs, we have developed more services and more programs for victims. The victims of domestic violence continue to be the focus. Our services can include, they're not limited to, but they certainly include safe shelter. We do counseling, court advocacy, we have a children's program, we have case management. Anything that we do at the shelter, we also offer on a non-shelter basis. We also have an offender program that we operate 2 classes for men. We have a female offender program. We also are considered to be the leading agency in our area for victim services. One area that we have really gotten into is the domestic abuse protection order. We have a complete packet of information where we can sit down with victims of domestic violence and talk to them about the protection order process. We've got a very strong outreach program where we do presentations, trainings. We do law enforcement training. Two of our staff are actually certified through Homeland Security, through the Federal Law Enforcement Training Center, where we are also recognized by the Mississippi Department of Public Safety. So any training that we give to law enforcement officers count toward their curriculum hours. And we also provide training to social workers, medical personnel, clergy, local professionals. We do presentations. During the month of February, which is Teen Dating Violence Month, we speak to probably somewhere between 1,500 to 2,000 youth within our area on dating violence and what a healthy relationship looks like. So when you look at the different services, housing services that we provide to the community, to our victims, we have the emergency shelter. We have a second stage housing right there at the shelter. And then we have the rapid rehousing, homeless prevention, and transitional housing.
The transitional housing program is through a federal grant that we received, and it assists people who are victims of domestic violence, stalking, or dating abuse or sexual assault into seeking safe shelter. The program assists the client for up to 12 months with financial assistance with rent and utilities. It also provides services with case management and other support services, such as child care, individual and group therapy, and referral systems.
There's 2 programs that we have available through ESG funding, and that's the Rapid Rehousing Program, which takes somebody who is literally homeless, say living in a tent, living on the street, in the park, or even hospital waiting rooms or abandoned buildings, and we take that individual and we can offer them short-term housing assistance for up to 3 months, depending on the situation that's needed. So that gives them a short period of time where they can hopefully find a job with our help. We will connect them to local staffing agencies, or if we see a job available in town, offer that ability to them to go apply. Our other program we have is homeless prevention, and that program is designed for people who are in their home, their family, or them as an individual. They already have an established home, but they may have gotten behind due to job loss or a change in their family situation. So the homeless prevention program will pay up to 3 months of arrears in housing assistance. And we want people to stay in their homes, and we don't want families to break up, so that's a great program too.
So our offender program is, it's a male program that we operate, and it's based on the Duluth model, which is a nationally recognized educational program for men who batter. And this is a program that it's either on the national level, it's a 24-week program, and there are times when we have modified it that we can also offer a 12-week class to individuals, but the 24-week class is something that we are just very pleased with. That a couple of years ago, we got a call from a woman who was in the hospital who had been shot by her husband. Her daughter was also in the hospital who had been shot by her father. This is a family that had been staying in a local motel, and the husband of our victim got real angry one morning, picked up a gun and shot his wife 3 times. One reason she survived is that at the time that she was shot, she had put her hand up like this, and the bullet actually went through her hand. We followed that family from the time that they were in the hospital. She came into shelter. We helped her through that very traumatic, very important first few weeks of the assault. We then continued to provide advocacy and follow-up services to her as she tried to navigate through the judicial system. Her husband was put on trial. I can safely say, am very pleased to say, that he is in prison now and will be there for a long time. This is a woman now who is speaking on our behalf, who just last year at our 20th annual conference did the keynote presentation. She's got a very powerful story, but she also is moving forward with her